Welcome to the On Your Mind podcast, where we believe mental illness can be temporary and transformative. Stay tuned for innovative, effective tools from experts in the field of mental health. Hosted by Timothy J. Hayes, psychologist. This podcast aims to change the narrative around mental illness. Move from a place of fear to a place of hope and solutions. Here on Your Mind.
Dr. Donald Raden is a functional psychiatrist. He blends an expertise in traditional psychiatry with a comprehensive understanding of functional medicine, and he offers an unparalleled approach to health that links the mental and the physical. He's analytical, perceptive, and kind, and he often succeeds where conventional methods have failed in treating everything from common disorders to diagnoses that may have gone unresolved for years. Thank you for agreeing to do this, and let us and our audience know about your work. I was digging around on the website, looking at all the various programs and the IV offerings and things like that. I don't know where you'd like to take this, but as I said on the phone, we would like to have you make this an infomercial for what you do. How is what you're doing different from what most other people do? And what's the kind of, we have a mutual acquaintance, Mark Haddis. And
start talking and see if this drives a discussion. I can tell you about my experiences in the world of psychiatry dating back to working in an inpatient setting roughly 15 years ago. And I was working in the inner city with very difficult children on an inpatient unit, and really was unsatisfied with the quality of care they were being offered. And what I started doing is, rather than just speaking about pharmaceuticals, I was looking at more the medical notes and looking at abnormalities in their physiological health to see if there was any correlation between their presenting symptoms and some medical concerns that were never addressed in the psychiatric model. And what I realized is that many of the patients that I've been medicating for an underlying psychiatric issue had multiple medical concerns that were never addressed. And then I started asking myself, is there a correlation between medical conditions and psychiatric presentations? And that's kind of where my journey began, as far as trying to connect the dots between the biological systems that can be dysfunctional that may present with psychiatric manifestations. What I started to invest my time in, was the analysis of the gut microbiome as an early intervention for psychiatric conditions. So I opened up a small outpatient practice where rather than just providing pharmaceutical applications, which I would offer to improve symptoms, I was also looking at biological systems that were dysfunctional. The first area of interest was, again, the gut microbiome, given there was a lot of research at the time, 15 years ago, showing a correlation between dysbiosis or dysfunctional organisms in the GI tract correlating with psychiatric conditions. And what I learned through my own research was that the abnormal gut flora was promoting an inflammatory cascade, which was causing an imbalance of the immune system, leading to inflammation in the brain, which was driving neurotransmitter abnormalities. So it was a gut immune brain axis. So I started delving into the science behind that and really focusing mainly on GI microbiome dysfunction to see if there was clinical change in the world of psychiatry. And miraculously, I was finding that by cleaning up one's GI problems, psychiatric conditions were improving. So that was sort of a stepping stone into the world of psychiatry, which opened my eyes to, is there another approach to psychiatric conditions that isn't just driven by a symptom-based checklist and a pharmaceutical intervention? What I've then learned throughout the 15 years of this journey is that there's a multitude of insults that go beyond the gut microbiome, which I do in my practice. So when someone comes into my office, let's propose that they've been diagnosed with, let's say, schizophrenia. The last thing I do is talk about the pharmaceuticals. The first thing I do is I get a good analysis through conventional labs, look at a roadmap of their anatomy. So I'm looking at hormones, I'm looking at metals, I'm looking at infections, I'm looking at both gut microbiome and systemic organisms. I'm looking at the immune system, I'm looking at autoimmune issues. And miraculously, through the 15 years of experience, I've been able to give people answers that are objectively defined versus subjectively defined, so that they can start looking at another application to improve their psychiatric symptoms that allows the body to heal itself, so to speak. So in the 15 years of what I've been doing, I've seen mostly treatment-resistant cases. And the reason why they're treatment-resistant in the psychiatric model is that no one ever looked as far as what other systems have been damaged leading to their medical or psychiatric condition. So I get a lot of chronically ill psychiatric cases, and I've had a wonderful opportunity to help these patients progress in their lives and heal the insult that triggered the condition versus the multitude of pharmaceuticals that led them to an unhealthy life quality. Now, what I've also incorporated into my practice is that what I've learned is many patients have such insult to their biology that in order for one to heal, you need other applications that may allow, for example, if someone has a nutritional deficiency in, let's say, vitamins and minerals, you can give them a cocktail of supplementation orally, but you're making a large assumption that they can absorb what they're ingesting. And what I learned objectively is that if you're giving people supplementation to target a certain biochemical pathway, for example, but they're not able to absorb what you're providing them, is there another avenue that can be used that would allow the proper absorption? And that's where I opened up an IV center. So in our IV clinic, we personalize someone's protocol to their health. So if someone comes back with a, let's say, for example, MTHFR abnormality, and I want to give them methylfolate or B12, oral supplementation is not always going to be absorbed properly. So why don't we go directly through the vein and get 100% absorption? So we delved into the world of IV therapy, and we do many applications in that realm because my patients are so biologically unstable that oral supplementation didn't lead to the goal of improving their quality of life. So I've been able to really come up with a medical model of psychiatric care that has really evolved over the years. I've been able to help many people, not only one feel better as far as their overall mental state, but providing them objective data. What is the roadmap to your health? How did you get here? I'm not a believer that depression is a Prozac deficiency or a pill deficiency. Yes, they help. I provide medications all the time. If you go down deep into the literature, you'll find that depression is nothing more than inflammation of the brain. Well, if inflammation of the brain is the cause of depression, where's the inflammation coming from? Is this coming from a nutritional deficiency? Is this coming from a gut biome abnormality? Is this coming from stress chemistry? Is this coming from an infection systemically? Where is the trigger? And that is what I've been able to accomplish with a lot of my patients, that I think allows them to have another perspective to psychiatric illness.
So how do people normally get into your care? What's the funnel that brings them to you?
Well, I think it's interesting because I never did marketing. I never marketed myself. And I think truthfully, it's word of mouth at this point. I think a lot of my patients have had a nice experience in that they're finally given some answers to their questions. And I think that they may tell their friends, or I seem to be finding those that have been struggling in the conventional model are the ones that are seeking me out. How they find me, I'm not quite certain. I would say that I'm open to any patient who has been struggling, and I would love to take on the challenge of those treatment-resistant cases, because I believe I have another way of looking at psychiatry, which has been very helpful for many people. But how they actually get into my office, I don't really know that answer.
So what's a typical course of treatment once somebody does find their way to you?
So when they come to see me, I like to get a subjective story, know what their history is, know what they've been through, where they've been going, how they've been treated so far. I look at their medication, and I always want to question if someone's on 2, 3, 4, 5 medications, for example, what each of the medications are offering them. Because a lot of times we have polypharmacy, and someone, for example, can have 2 to 3 mood stabilizers. And I always ask the question, is 2 better than 1? Is there a reason why you're on such agents? So I always look into the medications. And then what I do after we talk about the pharmaceuticals and educate them about what they're taking, I then look into the biology. In the general sense, I like to look at the systems-based approach. So I look at different systems. I look at the GI system. I look at the immune system. I look at systemic infections. I look at hormones. I look at nutrients and metal toxicity. That's usually where I start. And what I find is that there may be one system that's broken, there may be 2 systems, 3, 4, 5, 6, 7, I don't know. But I've done enough analysis with thousands of patients at this time that it's not a rabbit hole to no man's land. It's very directly linear as far as what they've been dealing with and what my experience has been. And what I've learned is the more complex treatment-resistant cases are most likely infectious triggered autoimmunity. And what I mean by that is that many of my patients have an autoimmune condition that's driving their psychiatric condition, which was kind of interesting to me. So I've been reading a lot of research on the correlation between infectious etiology, meaning a gut biome abnormality or a systemic infection, how that triggers autoimmune conditions. So we always hear about antithyroid antibody and anti-nuclear antibody, but what about things like anti-NMDA receptor antibody in the brain, or anti-dopamine 1 antibodies? So if someone has an underlying autoimmune condition that's affecting brain structures, that would be important to know. And many of my treatment-resistant cases actually have that, which changes their entire scope of life as far as interventions that can be offered. For example, I had a young lady, she was in her mid-20s, diagnosed with schizophrenia, came to see me. She was on 3 antipsychotic medications, still psychotic. And my first thought was, this isn't working, there must be something wrong. Well, what did I do? I did this overall analysis, conventional labs, and what I found was she had Lyme disease and Bartonella, which is a co-infection of Lyme disease, triggering an autoimmune condition to her brain, and she had an anti-NMDA receptor antibody. So her treatment protocol was not Zyprexa and Geodon. It was treating the infection, modulating the immune system, and lowering the antibody burden. Now, I've been working with this woman over the past several years because obviously it takes time to heal systems. But at this point in time, she is no longer on psychiatric pharmaceuticals. And when I had seen her originally, when she was on the multiple antipsychotics, she couldn't even look at me in the face. Now she's engaged in the world, she's employed, she's living her life, and she's content. To me, that was a wonderful case that really opened up my eyes to, are there things that we can offer people to give them objective data to provide them, like I said, a roadmap to their health?
So when somebody does find you and you start the assessment and you start looking for these treatment options, is this reimbursed through insurance? Are people having to pay out of pocket and then go fight their insurance companies for it? What's that side of the coin look like?
Well, my practice is out of network as far as my time, meaning everything is out of network coverage. So people have deductibles and they have their insurance coverage, so 70% reimbursement, whatever their out of network coverage is. Labs are all done through conventional. So as if you went through your general practitioner, labs are run through Quest, LabCorp. Applications, interventions for this woman, for example, antibiotics, those were covered by insurance, and IVIG was covered through their insurance company. Cost her nothing. There's other applications we do in the IV center that are reimbursable through out-of-network coverage, and that is the way our practice runs. So many of my patients are pleasantly surprised to find that there is coverage for the treatments that we offer as an out-of-network provider. I want to bring up something interesting to me that's more recent that I've come across that has been a miracle for my treatment-resistant, depressed, anxious clients, is the word ketamine. So ketamine therapy was used originally as an anesthetic at high dosages. And if you look at the research on ketamine at more of a lower dosage, you can see what it's doing. At the end of the day, it's promoting a molecule. It's called brain-derived neurotrophic factor. Turns out that's the antidepressant for your brain. It induces neuroplasticity. And what happens is when someone takes an antidepressant, it takes about 2 weeks to get a spike of BDNF, and then it goes down. It's not the neurotransmitter concept that we all believe. So you take a serotonin agent, serotonin goes directly to the brain, but you don't feel better for several weeks. That's because BDNF is not elevated. You take an oral antidepressant, BDNF goes up, and then it goes down. Well, it turns out that if you give someone ketamine after one infusion, BDNF is maintained for 2 weeks, which is a miracle for my patients. Now, this is an IV application that we've come across in the past year that's been a breakthrough for my patients. It gets them away from the pharmaceuticals and the interventions that are causing side effects. And I just want to bring that up because it's something that I've come across more recently with my research as far as what is the biochemistry, how is this working? Is this something that's realistic for my patients? And I've had some wonderful results with that. The reason why I bring it up is the reimbursement on ketamine is very, very good. So I like the idea of trying to push the envelope of psychiatry. I like to look at the sort of the biology of the intervention. And I think that no one can argue biochemistry. You know, you can do certain studies and have certain endpoints and such, but if the biochemistry resonates with me and it makes sense, let's move forward in that direction. Another case of mine recently was someone who had severe ADHD, by the way. So his ADHD required Adderall at 90 milligrams a day, which is a very large dose if you think about it. But then I started doing research on the mitochondria, which are the energy supply of your cell. So think about it as your cells, if they're not properly if you're not giving that cell enough energy, they're not doing the jobs necessary to work. So a brain cell, for example, if the mitochondrial is an insult, you're not having proper neurotransmitter release. So I went back into the literature and I looked at a guy named Abram Hoffer. He did some orthomolecular type work, nutrients. And I came across several studies using niacin for improvement of dopamine in neurotransmitters, so to speak. So it's been used for things like ADHD. It's been used for schizophrenia, interestingly. So I provided this gentleman NAD because it made sense to me biochemically. Let's improve the cell energy to promote proper neurotransmitters. And within 2 weeks, I was able to get this gentleman down to 10 milligrams of Adderall once a day. He's doing his NAD, which is a way of improving energy metabolism of the cell. And I've got him down significantly on the Adderall, which was a wonderful example that this patient's ADHD wasn't a deficiency in Adderall, it was a mitochondrial insult. So I guess what I'm trying to say is that my mission in life is to try to advance the world of psychiatry. I've stumbled along my way and I've tried things that haven't been successful. But I think I'm starting to come to terms with those applications that are effective and they work. And I'm very impressed with the outcomes that I've seen in my clients.
Well, it certainly is encouraging to hear that there's more to do than just run through the rotation of antidepressants, as each one has a little bit of an effect and then eventually doesn't work anymore. And then you go back to the doctor and you get another one, or you add one to the one or two that are already there. And of course, it's been a rather sad part of my work as a psychologists through over the years is to have somebody come in the door and they're on 2, 3, 4, 5 medications, and they're still in such a mess that they need somebody to help them try and sort out their life. And many times, and I'm just one therapist, but many times I've had people in my caseload, they get so fed up with the medication, they go to their doctor, get off all the medications, and they're far better off everything than they were on the cocktail that they were taking, and sometimes for years.
Well, if you were sitting in front of me, I would show you a very nice slide that shows the correlation between inflammatory cytokines, the immune system, and depression. So it's sitting right here. Depression is nothing more than an inflammatory process. Interleukin-6 goes up, TNF-alpha. These are inflammatory molecules in the immune system. Well, what's triggering it? Why are people having depression? If you look at the research, you can look at the gut biome, you can look at systemic infections, you can look at a bunch of things. The nice thing is that there is an answer to a lot of people's problems. It's about looking. And in my opinion, if you don't look, it's almost malpractice at this point. So what I really want to encourage other practitioners is just take a leap of faith and look. Simple labs, cortisol, for example. A lot of my treatment-resistant cases of depression are actually low cortisol. Now, cortisol is a hormone, and why would cortisol be low? Well, if you look at the research, if you have an allosteric load, like an infectious process, the body downregulates cortisol to unhinge the immune system to fight off a pathogen. So when a patient comes into my office, anxious as can be, depressed as can be, and they have a low cortisol, my next question is, what is the allosteric load that's suppressing cortisol? And you look and you find the answer. Very interesting that you can take this psychological model and apply medical applications to improve one's psychiatric condition. And I think that, don't get me wrong, pharmaceuticals have had its place in my practice. I use them all the time. I don't want to downplay what pharmaceutical agents have offered my patients. But those that haven't sought outcomes that they were ideal, you're on a medication. Well, why are you on it if you're not feeling better? Is there a reason why the medication isn't working? Is there other things that we could be seeking to provide you answers to the treatment-resistant condition you're walking in with? If it isn't a Prozac deficiency, there's got to be something wrong in the system that's causing the problem. And I like to say to the patient, to make it very simple, our job together is to look for triggers of inflammation. We're going to do everything we can to extinguish the trigger. So the diet, we'll look at your diet. Why? Because sugar is probably the most inflammatory food you could eat. What happens? Inflammation goes up, cortisol goes up. Well, cortisol has problems in regards to stress chemistry. So that's one piece. Is it something more biologically driven? And my patients are really trying to put forth effort. And unfortunately, a lot of them are putting forth effort without the roadmap. They're desperately looking for answers. And it's unfortunate nobody really has taken the time to invest into analysis. And I brought on some wonderful psychiatrists that have been under my wing to try to help these patients. And I think we're doing a really good job at that. I think it's about letting go of some of fears that some practitioners may have about looking for answers and maybe not knowing what to do with the data. And I'd be happy to help others be educated in this approach to psychiatry. Because I think that there's something available that we need to be doing for our patients to improve their qualities of life.
So most of this that you're discussing is, these are things you've found along the way. They're not what was part of your medical training. Is that correct?
I learned all of what I do after medical school. What I had to do actually is to rewrite the book of psychiatry in a functional medicine model. And the way I learned this was from an organization called A4M. A4M is a functional medicine platform. There's lectures. And as I was driving back and forth from the hospital every day, I was listening to lectures on hormones and toxic metals and immune issues and autoimmunity. And I was able to take all these medical applications and apply it to the psychiatric model. It took me a long time to get to where I am today, But I believe it was well worth it because my patients, I hope, have had good experience with what I've been able to teach them and what I've been able to offer. I think that unfortunately functional medicine is very driven in the world of a medical diagnosis, but they intertwine. Is cardiovascular disease inflammation of the vessel? Yes. Is hypertension inflammation of the vessel? Yes. Is depression inflammation of the brain? Yes. Is autoimmune disease triggered by inflammation? Yes. They all go together. And if you can look at these webs of systems and connect the dots, you can have a better outcome for an individual. So for example, if you look at the research, I think it's like 70% of people with depression have IBS. Isn't that interesting? Right? Well, why is that? Why are they having irritable bowel syndrome when they have depression? Well, the gut microbiome is a great place to look because it turns out I have a nice published study that shows that organisms that are not healthy release a molecule, it's called lipopolysaccharide. And lipopolysaccharide induces the immune system to activate, which drives depression. I have a publication to show that, but it turns out that LPS also promotes cardiovascular disease. So it's very important that once we improve their mental health, we want to look deeper. We want to fix the whole system. Why do we only have to deal with psychiatry? What about cardiovascular disease? And once we get people through the complexities of their psychiatric illness, we want to start healing their body in all areas of their systems. So I am a firm believer that the brain is connected to the body, and we need to take our time to look.
Well, you remind me of Dr. Jody Skillicorn, who finished her psychiatric residency and then found the book by Whitaker on the epidemic, the psychiatric diagnosis epidemic. And she was just shocked to find out that what they were teaching her in school for her medical degree and her psychiatric residency was not really helping people. It was, as you're saying, loading all of these medications on top of symptoms without understanding the underlying cause. And that led her to write the book, Healing Depression Without Medication. So you're not alone in this, that you've discovered that what you were taught in school is just a beginning point.
It is a beginning point. It's a good starting point. I think medical school offered me an opportunity to work with human beings, to be able to communicate effectively, to have that empathy, and to understand that a relationship is as important as a medication. And having empathy is very important. And I find a lot of physicians have this ego that makes it difficult to communicate with patients. And I feel that that is a disservice to the individual walking in the room. In my office, it's a dialogue, it's a conversation. And I make mistakes along the way, but I'm willing to take accountability for it. And I think that there's a relationship that's built over the years with my patients about a give and take, right? So what medical school really taught me is how to communicate to a patient who's struggling. I did learn, obviously, details of things that I don't remember, because I think that the details are less important than looking at the big picture. I think we can get really in depth and get stuck in the woods with, for example, genetic testing and all these unique applications. Don't get me wrong, they're unique. But if the terrain, if the systems are not connecting properly, you have to take a 10,000-foot aerial view first. For example, if you do an analysis and find X, Y, and Z nutritional deficiency and plug it into their protocol, but their gut biome is not healthy, what they're absorbing is not going to be helping them. So I like to take, okay, let's take it one step at a time. Let's get a 10,000-foot aerial view. Let's look at the different systems together. Let's understand the puzzle, the web, and we're going to go deeper and deeper and deeper once we sort of unveil problems. The practice of psychiatry is, in my opinion, is medical. I don't think psychiatry is just about the brain. I think it's very much medically driven, and my patients have proven it to me.
And of course, when you're taking that functional medicine approach, that gives you that view of systems within systems, and then you're not stuck just targeting a particular symptom.
Yeah, I think functional medicine has been misinterpreted by those that are not involved. I think integrative medicine is a fragile word because people think it may not be driven by science in conventional labs. It may be considered fringe medicine to others, but what it really is it's a physician who understands how systems intertwine with each other and how you connect the immune system with the endocrine system, with the hormonal system, with the gastrointestinal system, with the neurological system, and how these interrelate with each other. So you don't have to see 6 different specialists. You see one individual who can connect the dots between the different systems.
So are you using, in that sense, integrative medicine and functional medicine as interchangeable terms?
Yeah, I think integrative functional medicine has, I like to use the term precision medicine. Precision medicine is a more individualized approach to one's condition. And I think it's a way of sort of allowing us to dissect the abnormalities. So for example, if you come into my office with, let's take psychiatry off the table. Let's say you have hypertension. Well, I may not be just checking your blood pressure, but I would be looking at insults that drive inflammation. I'd look at the gut microbiome and metals. I'd be looking at stress chemistry and cortisol, because all of these end up with a symptom. It's a label, right? So the label defines the diagnoses, but that's only the tip of the iceberg. It's how'd you get there? So what functional medicine or precision medicine offers is a more detailed interpretation of that symptom you've been dealing with.
So because this seems to be a fairly evolving platform and a set of terminology, the functional medicine, the integrative medicine, the holistic, the complementary, the alternative, the conventional versus traditional, etc. I ask when we have these interviews, people like you, what terms would you look for if you were doing a search for a physician or a specialist to help you? What kind of keywords in labeling or identifying the kind of people you'd want to be working with?
I think you want to go to the organizations where people are trained. So for example, the A4M.com is where I was trained. You want to look at individuals that have gone through the training. And those are the people you want to be working with, because they've been educated by very, very high credentialed individuals to give them an understanding of this approach to care. And if you go to the website, you can find practitioners in your area that do that type of work. We all have our own sort of niche and our own approach to it, but it's another way of sort of finding that person that fits for you. Unfortunately, many of these people are medically driven, less psychiatrically driven. So there's not that many people that I know of that provide the type of psychiatric care that I offer in a functional medicine approach.
So the A4M is A, the number 4, and M?
4M.com.
And that takes you to the American Academy of Anti-Aging Medicine?
That's where I trained. That's why I went through the fellowship to expand my knowledge in the functional medicine area.
If we send them to you, that's at radenwellness.com, RADEN wellness.com.
Exactly. So if they are listening to this lecture and they're sparking an interest about what maybe had been lacking in their treatment, I'd be more than happy to assist them, to provide them practitioners in their area, or if they wanted to become part of the Raden Wellness community, we'd be more than happy to help them.
And you're located north of Chicago?
Yes, we are currently in Highwood, Illinois, just north of Chicago. We are expanding to other areas near term, but for right now, this is our home.
Excellent. Well, it's a delight to have more information about what you do. I know that we've had some mutual acquaintances that have benefited from your work, and I appreciate the fact that you would take the time to share with our audience your expertise. And I look forward to following your work. If you do expand, I'd like to stay in touch with you and or Amy and find out where you get those satellites open and do what we can to help more people learn about what you do.
Thank you very much for your time. I appreciate it.
All right. Take care. Dr. Donald Raden is a functional psychiatrist. He blends an expertise in traditional psychiatry with a comprehensive understanding of functional medicine, and he offers an unparalleled approach to health that links the mental and the physical. He's analytical, perceptive, and kind, and he often succeeds where conventional methods have failed in treating everything from common disorders to diagnoses that may have gone unresolved for years. He is board certified in general psychiatry and neurology, board eligible child and adolescent psychiatry, an active fellow of the American Academy of Anti-Aging Medicine, a fellow in the American Academy of Ozone Therapy, and a member of ILADS. His specialties include adolescent and child integrative psychiatry, immune system dysregulation, precision medicine, athletic performance sports medicine, anti-aging medicine, chronic illness, neurodegenerative diseases, and environmental medicine.
You've been listening to the On Your Mind podcast, offered by Journey's Dream, where we support people through mental health challenges to a place of true and lasting well-being. If you love our show, we invite you to visit onyourmindpodcast.org to join the conversation, access the show notes, and discover our helpful resources. Thank you for listening.